And if Ron Shopping doesn't, today actually marks 3 years since the first COVID case was announced in Erie County. Many of you likely remember this period of time vividly and how the world essentially shut down in what seemed like just a matter of days. Since then, almost 400,000 people in Western New York have reported a confirmed case of COVID. We've lost 4,700 of our neighbors. The majority of those deaths were Erie County residents, and that number for the county is just now over 2,900. Here in the town hall tonight, we're looking back at the evening exactly 3 years ago when we broke into regular programming with this breaking news. Watch. And hello, everybody. We're coming on the air with breaking news right now surrounding the coronavirus pandemic. There are now 3 confirmed cases here in Erie County. Governor Andrew Cuomo making that announcement late this evening, saying that the 3 patients here locally are part of more than 600 statewide. All right, and back out here live. Again, the 3 cases was the breaking news back then, and exactly 3 years ago, that was in 2020. As we look back and also try to look forward, right now, Dr. Gale Burstein joins us live. She is the commissioner of the Erie County Department of Health and has held that position for the last 11 years and through the entire COVID-19 pandemic. Dr. Burstein, I really appreciate you coming on what I think is a very significant night. I was saying to you in the commercial break, I don't know if it feels like it was a year ago, 3 years ago, or 15 years ago. I know it's been a really difficult time for so many people. What do you want to start with just this question? What do you wish you knew now, 3 years later, what you know now that you wish you had known back then 3 years ago?
Well, it has been a long 3 pandemic years, and we've learned so much about the COVID-19 virus, the SARS-CoV-2, that initially 3 years ago today, we knew essentially nothing about it. Now we know how to prevent the virus. We can implement strong preventive measures. We learned that this is a respiratory virus, so it's transmitted through respiratory secretions, and we also know that masks are very protective against COVID-19 transmission. So again, day one, we wish we would have known that masks really would have protected many vulnerable people in our community. We also were, our scientists were very sharp, and they developed several vaccines to protect us against COVID-19 in a very short period of time. And so we figured out, working with our community partners, working with other county partners, how to operate mass vaccine clinics, and we were very successful. And we were able to immunize thousands and thousands of Erie County and Western New York residents to protect them against COVID-19. And those vaccines still work. Now we have new bivalent vaccines that work a little better against the variants to protect people from developing moderate to severe disease and hospitalization and preventing deaths. And we know that the vaccines work very well and they're very safe and effective. So I wish we would have had those vaccines from day one. Also, we have great antiviral therapy to help people recover quickly and prevent hospitalizations and death of people who are already infected with the SARS-CoV-2 virus. Paxlovid and other antivirals that we figured out how to get them into the bodies of people that were infected with COVID-19 very quickly. Our pharmacies were great partners, and there are many people that are still using those medications today when they get infected. So I hope people make sure that they know that when they're infected. And another great asset that was developed are the very, very sensitive tests. So we had the PCR tests. Those came out first, and those are very, very sensitive. But those were in high demand and not a lot of supply. But we overcame that. And bioscience invented some rapid antigen tests for SARS-CoV-2. And so now we can buy these tests over the counter and test ourselves if we have symptoms. We know where we'll stand if we're infected with COVID-19 or not, and we'll know if we need to get in a prescription for an antiviral medication to keep us out of the hospital and help us recover quickly. So we all wish we had that going into this pandemic.
Yeah.
So we have, and also we've built a lot of great partnerships, you know, not only within county government, but also outside of county governments with other local governments, other municipalities, and really strengthen our relationships. And also with our school systems, our places of houses of worships, our hospitals, our clinics, you know, the healthcare system in general. I mean, I think our community really came together and everybody stepped up and pitched in, and we were really able to do well, you know, considering the seriousness of this and overwhelming this pandemic.
Dr. Burstein, I have about a minute left here. I know that you're a big proponent of vaccination. You talked about it there. We aren't seeing rates as high as we did even a year ago. And I want to ask you specifically as a pediatrician about children. A lot of parents have chosen not to get the vaccine for their kids. We've heard about myocarditis. We know it's a huge topic online. Studies have shown that especially younger males seem to suffer more from myocarditis than other adults, but it's still recommended for all kids. What do you tell, in about 30 seconds here if you can, what do you tell parents who have just chosen at this point not to get the vaccine for their kids?
Well, we know that young children can become very, very ill with COVID-19. We also know that these COVID-19 vaccines are very safe and effective for young children as young as 6 months of age. We also know that these adverse events that have been reported associated with the virus are very rare. And if, say, a young person, a young adult does develop some mild myocarditis associated with the vaccine, the myocarditis that they could develop from COVID-19 infection itself could kill them. It can be very, very serious and very difficult to recover from. So overall, I say, please strongly talk to your pediatrician, talk to your child's doctor. The COVID-19 vaccine is very effective and very safe. We all love our children so much. They're our most precious assets. And so a COVID-19 vaccine and a flu vaccine and the other recommended vaccines will help your kids stay healthy and happy.
Dr. Gale Burstein, again, can't believe it's been 3 years, though in other ways it feels like a lifetime. Commissioner of the Erie County Health Department, thanks for taking some time for us.
Yeah, thanks for the time.